Good afternoon, and thank you for joining us today in this Challenge live stream event from Retina Physician. My name is Mari Rodriguez, and I will be your host today. I am a retina specialist with Future Retinal Associates, and I practice in Massachusetts. I have no financial disclosures. As you know, our plan is to post an image challenge each month and then discuss the diagnosis and management using this platform. We would love to hear your thoughts online. You can find us in Facebook, LinkedIn, YouTube, and Twitter. You're also welcome to write on the chat and share your thoughts with us during this event. Today, we will be discussing the case of a 53-year-old gentleman referred by an outside provider for a fundoscopic evaluation. Although he denies any family history of vision loss, he endorses low decline in vision in the right eye more than the left. On examination, his visual acuity was 20/50 in the right eye and 20/40 in the left, and he had normal intraocular pressures. The slit lamp examination was significant for 1+ nuclear sclerosis cataract, but otherwise it was unremarkable. On our dilated examination, we could see scattered yellow-white pisiform fundus flecks throughout the posterior pole. Also, on fundus autofluorescence, as you can see here, we could capture these flecks, and they were mixed hypo and hyper autofluorescence. There was one patch of atrophy noted in the right eye, and then in OCT, as you're going to see here, some of these flecks could be noted, but there was no intraretinal or subretinal fluid that was noted. There was also no choroidal neovascularization that was detected. Based on our physical examination, we suspected Stargardt disease. This is a rare disease affecting 1 in 10,000 individuals, and the disease is caused by mutations in the ABCA4 gene through autosomal recessive homozygous or compound heterozygous transmission. There's a lot of variability in the phenotypic presentation of the disease, and this is correlated with the levels of ABCA4 that are expressed. And the visual acuity can range from 20/20 to 2400, and the age of onset is also highly variable. In the disease, accumulation of the AE2 in the retinal pigment epithelium as lipofuscin leads to poor function of this epithelium and dysfunction of the retina as a result. Stargardt disease remains an incurable condition, but the first step on finding a treatment for these patients is in providing a definitive diagnosis. Currently, some companies offer genetic testing to patients, and we obtained genetic testing for this patient using Blueprint Genetics and confirmed that he was a compound heterozygote for Stargardt disease. These patients should be advised to avoid UV light exposure and to wear sunglasses. And currently, there are multiple clinical trials underway to see whether the disease progression can be stalled. One of them is exploring whether deuterium-enriched vitamin A, which prevents vitamin A dimerization, may be a good treatment for this disease. And others are exploring if gene therapy is an option for these patients with a confirmed mutation before the onset of the symptoms. However, the large size of the ABCA4 gene has made packaging challenging with the vectors that we have available. And others are exploring the efficacy of complement inhibitors in this disease, as well as stem cell transplantation. So we referred the patient to the Center for Inherited Retinal Disorders in Boston to see if he was a candidate for participation in one of the clinical trials, and we'll follow up yearly otherwise. Again, thank you for tuning in today. You can leave us a comment online via our multiple platforms, and we hope to see you again soon in about a month as we discuss another interesting case. Thank you.